Joining us now is infectious disease specialist Dr. Isaac Bogosh. Dr. Bogosh, thank you very much for joining us to talk about this. And let me get your thoughts on these rising cases, because this is all at a time when certainly there's been restrictions in place in Quebec and in Ontario, and yet we're just seeing these numbers continue to rise, not even to mention, of course, Manitoba and Alberta.
Yeah, it's really challenging to watch, and certainly in places that have restrictions, I think we can say a couple of things. One is that it does sound counterintuitive, but those restrictions have actually slowed the rate of new cases per day. So it's not like they're doing nothing; they're clearly doing something, and you can see the rate of new cases slow down. Still, if you're getting 1,000 or 1,200 new cases per day, that's not acceptable. That's too many, and ultimately, the healthcare systems are going to feel the pinch. But they have slowed the rates of change. The issue is, of course, there still is transmission that is occurring, and it's a good idea to have a much better understanding of where that's occurring, so that you can really create some policy to help pinch that.
Yeah, and I'm not sure if you were able to hear. I was just talking to a restaurateur about, obviously had some restaurants and has to remain shut down. And talking about, we really don't have a lot of that data in terms of the infectious spread because of restaurants. And a lot of restaurateurs are saying this is just not fair. We were doing everything right.
Yeah, I certainly have a tremendous amount of sympathy for people in that industry, and not just restaurants, but bars and gyms and other industries that are impacted by this. This is tough. Like, any of these measures are clearly have financial and psychological ramifications. So it's extremely challenging. It's interesting. I think that the epidemics are different in different parts of the country. Of course, there's some similarities, but they're not exactly the same. And we've heard some senior public health officials in British Columbia say that they're taking a data-driven approach for their province, and they're saying, you know what, we're not seeing a ton of outbreaks associated with restaurants, and that's why they've allowed in-person dining to continue with some restrictions, but they still are allowing in-person dining to continue. So, for example, people have to stay within their family units, but based on their local data, they just weren't seeing a tremendous amount of new infections from that sector, so they didn't shut down indoor dining. Clearly, that's different in other parts of the country because we're seeing different policies constructed there.
Yeah, well, and speaking of different policies, let me ask you this: the CDC coming out, seemingly adding to, or maybe even changing restrictions, not restrictions, but policy recommendations on mask wearing. Now saying that actually, because we've been told that wear it for everybody else so that you don't spread the infection, but now the CDC is saying yes, we think that if you wear it, you're protecting yourself as well. What do you make of this?
Yeah, it's interesting that they've added that to some of their recommendations, and I think it's just being honest with the data. I think we also have to remember that a lot of these conversations happened long before COVID-19. It's just that it wasn't of huge interest to the entire world, but in the medical and public health and scientific communities, these conversations have been happening for decades. And we've known for a long time that masks at an individual level, if you put one on, you're going to prevent the spread of the infection. It was always debated to what extent that impact would be on a population level, and it was always somewhat debated as the extent to which the mask wearer was protected. But there's been a tremendous amount of data that's been generated through this pandemic, and I mean, I think it looks like they feel that they have enough data to make that change. Great, that's great news.
Well, one thing that we have heard repeatedly is wear your mask. So there again, here we go. Dr. Bogosh, thank you very kindly.